Mr. President, there has been a lot of talk here on the Senate floor about this so-called skinny health package. And if you believe the reports, the skinny health package was going to be written today at the Senate Republican lunch. On the day the Senate is supposed to vote, the future of American health care may have gotten an overhaul between the salad course and the entree. And I'd like to talk a little bit about where things are and really contrast these reports about the skinny health package with the process that brought together the Affordable Care Act. Our colleague, President of the Senate, now serves on the Finance Committee. There were dozens of hearings in the Finance Committee about the Affordable Care Act. There were dozens of hearings in the Health Committee. Both committees had markups that lasted longer than a week and incorporated ideas from both sides. I was a pretty junior member of the Finance Committee at that time, and I remember a flock of Republican amendments being added in the Finance Committee to the Affordable Care Act. When the bill came to the floor, the Senate debated it for 25 legislative days. It was the second longest consecutive debate in history. We're not seeing anything that resembles that today. We got a rush job. And I'm going to try to spend a few minutes talking about what comes out when you have a rush job and some of the red flags that I think my colleagues, particularly some on the other side of the aisle who are thinking about voting for this skinny package, might want to think about. Any senator who believes that Medicaid makes it out of a skinny package without taking a hit ought to take a look again. Senator Murray and I spent a long time working with the Congressional Budget Office to, in effect, get them to do some analysis of some of the ideas that are part of a CBO package. What the Congressional Budget Office said, and they are the impartial, nonpartisan, umpire, is that under this skinny package that's not supposed to do any harm to Medicaid, the Congressional Budget Office said, and it's on the first page, Mr. President and colleagues, first page of the CBO report, Medicaid gets hit with a $220 billion reduction under this so-called skinny proposal over the course of a decade. So if you're one of our colleagues on the other side of the aisle who said you really feel strongly about Medicaid and about seniors, Medicaid, we all know, picks up the cost of 2 out of 3 nursing home beds, covers a wide variety of community-based services. I've really just loved to watch the development of those community-based services. We started them in Oregon back in the days when I was director of the Gray Panthers. And the idea that Medicaid, in this so-called skinny budget, according to the Congressional Budget Office, would get hit with a $220 billion reduction is, I think, something my colleagues on the other side of the aisle who are saying, hey, the skinny package isn't going to have any implications for Medicaid would want to take a look at, because I think the Congressional Budget Office is saying that there really are implications for vulnerable seniors, for kids with special needs, for the disabled, for all of those Americans who are walking on an economic tightrope every single month, balancing their food costs against their fuel costs against their health bills. The numbers on skinny repeal show that 16 million Americans lose coverage and premiums are going to jump by 20% immediately if it becomes law. Industry experts are saying there isn't any way that this can work. It just causes too much bedlam and uncertainty. It's like pouring still more gasoline on the fires of uncertainty in the marketplace. Republican and Democratic governors have come out against the skinny bill. And by the way, as the ranking Democrat on the Senate Finance Committee, I guess we got 100% of the senators who are here who serve on the Finance Committee. I don't even see Republican senators making much of an attempt to defend the skinny bill on the merits. In fact, many of them in the halls seem to be telling folks, including some folks, I believe, in the press, that they're kind of worried about it becoming law. Now, there are a few directions for this process to take. It's possible the House could, if you pass it, just take up the skinny repeal and then they could pass it. And my guess is when people think around here about what that means and what these CBO numbers, the premium hikes, the implications for Medicaid, I think people who look at those CBO numbers are probably getting a little heartburn. Republican colleagues in this chamber who are thinking about being for this. Now, the other possibility is that passing the skinny repeal bill leads to a conference. Now, I'm telling you, if it heads to conference, skinny repeal is sort of a gateway drug to Trump care. The fact that a conference is going to fix every problem and solve every disagreement is just fantasy. If this gets to conference and suddenly there's a new Republican replacement plan that everybody likes, about as likely to happen, Mr. President, as my joining the NBA for the upcoming season. So let's take an honest look at how the debate has unfolded. Republicans have had 7 years to come up with a replacement to the Affordable Care Act that they can all agree to. Obviously, that has not worked out. In the Senate, the process flatlined until the majority leader began the shell game that's culminated in today's vote. There weren't 50 votes for Trump care here in the Senate. There weren't 50 votes for repeal. That's why skinny repeal is the only proposal left on the table. And as I indicated, who knows what was done at the Republican lunch between the salad course and the entree today at noon. But let's be clear about what's likely to happen when the House gets involved. The guarantees that members of this body got to protect their constituents, they are out the window. Kids with disabilities and older people, say a baby boomer. And my colleague in the chair, a physician, a skilled physician, understands this. You get a baby boomer who's had a stroke, late 50s, early 60s, they're in a nursing home. They're going to really face some challenges in terms of how to be able to afford that care with the kinds of cuts that CBO has said on page 1 of the report to Senator Murray and I, they believe will take place in Medicaid. Rural hospitals, we know that these rural hospitals are the economic engine of communities. I've made 8 stops on a rural health care listening tour in my home state. And what we see is without rural health care, you aren't going to have rural life. And it's going to be particularly important because other efforts could conceivably result in seniors between 55 and 64 paying 5 times as much as younger people and getting fewer tax credits. Nobody can honestly say that the millions of Americans with pre-existing conditions will be shielded from discrimination. And what a step backward that would be. Mr. President, as before you are here in this body, But 14 senators, 7 Democrats and 7 Republicans, joined me in the 2008-2009 period. Many of them are still here on both sides of the aisle. Republicans were a part of the effort. Democrats were a part of the effort. And we wrote a bipartisan bill that had airtight, loophole-free protection for those who have pre-existing conditions. Got it in the Affordable Care Act. All the senators who joined on that bill ought to feel pretty good about taking a big step to move America away from health care that's just for the healthy and wealthy. Now we're talking about the prospect of policies that will walk that back. So it's my view that the clear choice for my colleagues who don't like the risks in skinny repeal and don't like Trump care is to reject the process. It seems to me the surest way to prevent a bill you don't like from becoming law is to vote against it. Quaint idea. Just vote against it. Now I want to turn also to another bit of breaking news which comes from our parliamentarians who do so much good work, and it's an extraordinarily stressful job. Another key part of the Republican plan has been deemed ineligible in the last few hours to move forward via the partisan approach, reconciliation. The decision pertains to a proposal that lets states undo the consumer protections built into insurance marketplaces under the Affordable Care Act. That proposal will not get fast-track privileges or a 50-vote threshold under reconciliation here on the Senate floor. Here's what that section of the bill was all about. I wrote a provision, again, our group of bipartisan senators, 14, 7 Democrats and 7 Republicans, can take credit for this as well. An issue that the President of the Senate and I have talked about a number of times, letting the states be the laboratories of democracy, taking the lead on creative health solutions. And so out of our bipartisan bill, 14 senators, we said we're going to give the states the chance to do better. The states would have a chance to do better. And when we did it, Mr. President, we got some flack, sort of from all over the political spectrum. But we pushed very hard, and we got it in to the final legislation. And it was about providing flexibility to the states because so many on both sides of the aisle, my guess is our friend from Pennsylvania and anybody who's on the Finance Committee has heard again and again state officials, business leaders, and others have said, if you just give us the freedom, we can do better. They don't say, give us the freedom to let us do worse. They say, give us the freedom to let us do better. And that's what Section 1332 was all about. It said states could chart their own course on health care as long as they were going to do better. Better for coverage, better for affordability. Made it clear, if you feel you can do better, if the Louisiana legislature says, you know, we got ideas. We got ideas for what works for Louisiana, may not necessarily work for Oregon. Give us the freedom to go do our thing. That's in the Affordable Care Act, the freedom to do better. And I'd be the last person to tell my friend from Louisiana, a skilled physician who's got a great interest in health policy, I'd be the last person to say, hey, I'm going to dictate to Louisiana what an approach involving a waiver should be all about. Quite the opposite. I'm prepared to say to Louisiana, to Pennsylvania, to all our colleagues, you got ideas that are going to do better by people, better coverage, more affordable? God bless you and your constituents. That's what 1332 is all about. And we said, all we're going to say is we got to have some basic consumer protection here. You can't just go get a waiver and go off and do nothing, or just spend the money on some pork kind of project. You got to do better by people. Better by people. Better coverage, more affordable coverage, having basic consumer protections. Senate Trump Care bill tried to basically throw those consumer protections out the window. States would be able to get waivers to opt out of basic consumer protection, basic, plain vanilla consumer protection for coverage and affordability. And my view was that kind of stuff is a backdoor way to set up junk insurance. Junk insurance that wouldn't cover much more than gauze bandages and aromatherapy. Now, some people may wonder why this is important today, since the Senate resoundingly voted down the Better Care Reconciliation Act earlier this week. The answer is that my colleagues on the other side still seem to be trying to shoehorn this scheme for worse coverage, not better coverage under a waiver, into the skinny repeal proposal the Senate's going to vote on in a matter of hours. But the decision has come down. The decision has come down from the parliamentarian that regulatory changes that gut consumer protection, that was right at the heart of that waiver in the Affordable Care Act, isn't going to fly. And frankly, I think it calls into question what the parliamentarian said. It calls into question whether any of these big anti-consumer schemes are going to get 50 votes. So this is yet more uncertainty ahead if Senate Republicans pass this skinny repeal bill and the debate drags on. Now, at the risk of boring our wonderful pages and the staff who have heard me on the floor saying this before, there is a bipartisan approach. And I think I've shown my bona fides over the years with respect to bipartisanship. I mentioned our universal coverage bill. First time Republicans, Democrats came together and said, this is something where there's common ground because it's common sense. I've worked with colleagues, perhaps some of the most conservative members of the Congress, on initiatives to move health care forward. That's what I've wanted to dedicate my entire professional service to, bipartisanship in health, ever since those days with the Oregon Gray Panthers. That's what I always thought was the most important thing, because if Senator Toomey, the presiding officer, all our colleagues, all the people here, if you don't have your health, then pretty much everything else is uphill. So health care has always been the most important issue. And important issues you've got to deal with in a bipartisan way. And I have said, which is why I wanted to alert the pages and the professional staff about the prospect of true boredom and just nodding off for the afternoon, that there is an alternative. If Republicans drop the reconciliation our way or the highway approach, colleagues on this side have said they want to work on a bipartisan basis. And it doesn't take rocket science to figure out what that needs to be. The first thing that Democrats and Republicans would do is stabilize the private insurance market. First thing. Everybody over here said the Affordable Care Act is far from perfect. And we've got colleagues here, Senator Kaine with his reinsurance proposal, Senator Shaheen with her cost-sharing effort, Senator McCaskill to try to help areas where there's little or no coverage. And I'm certain that there are Republicans who have ideas that would be part of a good bipartisan package if we drop this our way or the highway partisan approach. And we ought to be working together to bring down prescription drug prices. I've spoken on a number of occasions with the presiding officer about the fact that literally out of nowhere over the last few years, we saw a whole industry develop around prescription drugs where a bunch of middlemen are supposed to be getting the consumer a good deal on medicine, but nobody knows what they put in their pocket and what they put in the consumer's pocket. They're called pharmaceutical benefit managers. So I said, how about a little sunlight on that? How about a little sunshine, best disinfectant? I sure think people ought to be able to work together on those kinds of things. That, colleagues, is not what is on offer right now. I urge my colleagues to say, we are getting out of this shell game. Nobody has to accept the skinny repeal option or the dictates of the other body. If you're unhappy with the option on the table, and I hope more people will be unhappy now that I've outlined what some of the key considerations are in this Budget Office report Senator Murray and I worked hard to get, I hope some people are going to think again, especially on the other side of the aisle, about voting it down. 20% premium hikes, those go into effect, colleagues, on January 1 of this year. And I expect we'll have more information on it, but I think they're going to be 20% hikes after that. That's real. That's not what some interest group made up or some liberal partisan or anybody else who has an axe to grind. That's what our impartial umpire found. So if you're unhappy with a proposal with those kinds of options, you ought to vote it down. And I want to close by way of echoing a point that so many colleagues on this side have said. This is not about saying, look, we're just against what you want to do. Quite the opposite. For all my time in public service, I've said what I want to do is try to find common ground with people of common sense. Let us defeat this skinny, sham, shell game kind of process that looks like what we're going to be voting on tonight, and then get serious about doing what legislators do, which is not take each other's crummy ideas, but take good ideas and work on them in a bipartisan way. Mr. President, I yield the floor.
Mr. President.